The oldest continuing study was started in 1949 in Framingham, Massachusetts, and is called the Framingham Heart Study.
We've provided new evidence based on lipids.
You wouldn't just treat fever with Tylenol. You want to know the cause of the fever.
The cholesterol paradigm based on measuring LDL and worrying about saturated fat has now shifted.
Well, really what stimulates science is interactions among scientists. They begin discussing a topic and suddenly an idea is stimulated through that interaction.
A group of us got together and started working on developing a national organization and developing chapters.
His LDL levels in the bloodstream, and where 200 would be considered a relatively high, this kid's level was 700.
I think we took a new direction with the NLA in trying to develop expert panels that could address issues that are really important for our members.
What patients really want to know, if I make a change, will it make a difference?
It's all about seeking facts and new ideas about how to understand life, disease, and come up with ideas
How
for...
thrilled I was at the international recognition these two lipid drug safety reports had brought to the national.
And so it's an opportunity for us to learn from each other.
And out of this was born an organization that not only is focused on clinical lipidology, but it's also focused on teamwork and multidisciplinary care. That's in many ways, I think, was ahead of its time.
Many milestones in the past helped mold the foundation of the National Lipid Association. It's only through the understanding of the formation of SELA and its growth that one can get a true picture of the origins of the NLA. Three pivotal moments helped the concept of the idea, dating back to 1929, when HDL was first isolated. In 1948, the Framingham Heart Study began. And in 1974, Drs. Joseph Goldstein and Michael Brown discovered the LDL receptor and later received the Nobel Prize for their research. In 1997, the United States was in its 10th year following the release of the first adult treatment panel guidelines by the National Cholesterol Education Program. These were directed squarely at the physician in attempting to guide the appropriate recognition of lipoprotein abnormalities as a major factor in coronary heart disease. These guidelines were meant to raise self-awareness that blood lipid problems could be treated with scientifically documented proof that prevention of clinical events was possible. The feasibility of success had been greatly enhanced because in September of 1997, the approval of the first statin, lovastatin, was given for prescription use by the Food and Drug Administration. Additional studies were reporting major reductions in vascular events with statin treatment in patients with and without known vascular disease. However, in 1996, assessment of physician practices revealed that only about half of patients were having their lipoproteins assessed, and the application of treatment guidelines were even less evident. The use of statins was increasing, but patients were usually left on low doses without adequate follow-up and without assessment of goal attainment. It was in this period that Parke-Davis and Pfizer were attempting to co-market their new and most recent statin. Their observations in the community convinced them that the missing element was education of the physician community regarding the effectiveness and safety of statins. Furthermore, they felt physicians had not accepted that the NCEP guidelines were really relevant to their patients and that they should be a standard of care. This set of problems prompted the regional representatives of Parke-Davis and Pfizer to seek Dr. Virgil Brown's advice about addressing this need to change physician practice. In 1997, a group of pioneering lipid researchers and clinicians formed the Southeast Lipid Association in Lake Lanier, Georgia. Dr. Brown had been a member of the original adult treatment panel in '87 and had recognized with his colleagues that simply providing guidelines did not necessarily motivate action. The federal government did not extend beyond publishing and verbally promoting the documents produced by the NCEP. There were no funds for effective education. Fortunately, in those days, close working relationships with the pharmaceutical industry were not thought of as criminal behavior. Having the opportunity to address these issues with financial backing was very exciting, and Dr. Brown's immediate reaction was to call on his fellow educators who were also experienced lipidologists in the Southeast. Enthusiastic responses followed from Brian Brewer, John Guyton, McCrae Linton, Maria Lopez Varela, and David Robertson. They were able to meet in Atlanta on August 16, 1997. The organizing committee defined itself as the Southeast Lipid Association and agreed on its mission statement and objectives.
We came up with a mission statement for the new organization to enhance the practice of lipid management in clinical medicine. That only took us an hour. Subsequently, we came up with 4 objectives for the new organization, and I think that the 4th objective was the most important one. These 6 physicians decided that the membership of the new organization, the Southeast Lipid Association, would include all participants in the lipid clinic team: nurses, advanced practice providers, PharmDs, dietitians, clinic managers, laboratory managers, not just physicians. These staff people in the lipid clinic team and these professionals besides physicians would bring tremendous enthusiasm to the new Southeast Lipid Association, setting the stage for its success and the subsequent success of the National Lipid Association.
We met for a couple of years before we finally decided it was time to either create a society or give up on the idea. And we decided to organize a meeting where we invited most of the people, both from academic medicine and from private practice that was interested in lipidology. And basically the meeting was to determine was enough interest in creating a society or not. And the meeting was an overwhelming success. And everyone seemed to be extremely interested in creating a society of clinical lipidology. And so that's how SILA was started. And Dr. Virgil Brown was the first president of SILA, and eventually I became the first president of SILA.
The minutes of this meeting recognize many themes that continue today in the National Lipid Association.
I think one of the reasons why the society was a success and we were able to, in reality, create a National Lipid Association eventually was because all of us were extremely determined to make it succeed. And all of us have that fixed idea that management of lipid disorders was essential. And people need to learn how to treat lipid disorders, and we needed to learn how to treat the patients better. And in reality, create, have a vision that was common to all of us, and we never really gave up on it.
The importance of defining the practice of lipidology and giving it credibility in terms of training and certification was recognized.